Now moving on to other segment to show you even more clearly. Here you see a patch. This is the left lobe of the liver in transfer section. Okay. Now in the left lobe of the liver, you are clearly seeing a map-shaped area within the lateral segment of the left lobe. And on the other side of the image, you are seeing a fatty liver. And on the left side, the liver is also fatty, but the only difference is that the fat has not been deposited in this map-shaped area. So we cannot call it a geographical liver. We will say that, well, this is a focal fat spared area in the fatty liver, provided the liver is fatty, and you can see the blurriness of the vessel margins, right hepatic veins, middle hepatic vein, and all the other hepatic veins. And you can see the diaphragm becoming thinner and thinner, and the lower half of the liver becoming darker and darker as the sound waves travel through the liver, because fat absorbs the liver rapidly. So that's the reason. By the time the sound waves reach the diaphragm, they are absorbed to an extent. This area becomes hypoechoic, rather hypoechoic, and we cannot say that this is focal fat spread area. The reason is, now compare these two, and you will come to know the difference. Compare both. So it's very distinct, sort of benign time incidental findings with no complaints. Patient usually will present with no complaints whatsoever. Now let's move to another segment and see what does this image speaks of. That this is the same image that you saw in the previous segment. Here is the map-shaped area, and this is the liver. This is the right lobe of the liver, and here you see black kidney. So the parenchyma of the kidney is appearing black because of the fatty liver. So whenever there will be so much of fat within the liver, you are going to get these, see the right kidney parenchyma black compared to the normal. So these minor things have to be remembered at times, because if you don't know this difference, one may easily label this area as a focal lesion in the liver, or a mass. It can be labeled as a mass. However, see its outer border and see the fatty areas, and you can also see small patches of focal fat spared area within the fatty liver. So now let's move on to the other part of this, another segment that will again explain you a bit. Let me tell you that how a normal liver will look like. You should know that rather. So let's go further and study the same segment. Now this is again the same segment. This area is the same segment of the left lobe of the liver. If you concentrate, this linear structure is the chordate, the ligamentum venosum. This is the chordate lobe, and this is the IVC in transverse section. So this is the area under consideration. And if we go to the right liver, see the diaphragm, see the blackness anterior to the right diaphragm, that of the liver parenchyma, and see the brightness, level of brightness at the anterior part of the image, that of the liver parenchyma. So this is these views were taken to make you sure that this is a fatty liver, number one. Number two, this is the diaphragm and this is the portal vein. So now this image was intentionally taken to show you the difference between some other areas mimicking focal fat spared area and the focal fat spared area itself. So this is a short study regarding the focal fat spared area in fatty liver.